it's Yaz from Yorkshire Peaches Therapies, and welcome back to Hop, Skip and a Jump. Today's episode is with the amazing Jess from Little Large Dogs London. We discuss hyperarousal in bull breeds. We also do touch a little bit on behavioural euthanasia, and we kind of dive a bit deeper into the links between pain and behaviour. Let's get into it. Jess, I am so grateful for your time today. I have been eagerly waiting to have this conversation with you. So, for people who haven't come across you before and haven't come across your Instagram, just tell us a little bit about you. How did you get into this world of dogs, this crazy world of dogs?
Crazy world. Okay, so my name's Jess. I'm a behaviourist from a more clinical background. So I've got a background in biomedicine and zoology. But prior to that, I worked in non-destruct rescue. I mean, going on 16 years now. So that means rehabbing, sort of fostering, rehabbing, assessing some of the worst kind of behaviour cases in the UK that maybe didn't make it into other rescues, and just trying to find out whether, actually they are workable one way or another, and whether there's a safe space for them. When there isn't a safe space, obviously they are humanely euthanized. But when I say non-destruct, what it means is, we try really hard to make things work for them, but dogs aren't kennelled long term. But I ended up taking a lot of those dogs into my own home.
Right. Okay. So interesting about the I'm just going to jump in on the non-destruct kind of aspect, because as from someone who doesn't work in rescue, like I've fostered and I have a rescue dog, but it's very different to the type of work that you do. My assumption was that actually non-destruct was that they do stay in kennels. And
I mean, you've got non-destruct rescues where dogs sit in kennels and rot for the rest of their life, which is not good. And then you've got kind of non-destruct rescue where the dogs stay at the rescue in a sanctuary setup. But if the dog doesn't seem like they're workable, then essentially the dog, if a dog's killed someone or something like that, the dog doesn't get into that rescue, essentially. So the dogs may have multiple bite histories and things. And if a medical situation is found, if there's a neurological issues, then the dogs are put to sleep for medical reasons. But generally speaking, we take all the rescues that I have worked with, the dogs that I've taken in, we've taken in on the basis of this is probably workable in some way, but they need more medical intervention, time to decompress, all the rest of it. Because as we know, a lot of very complex looking behaviours end up being, environmental, medical, all of those things. So yeah, in terms of when I describe non-destruct rescue, definitely in my earlier days, I was probably sending dogs to where they would sit in sort of kennels and things, but the last sort of 5 years, it's not something that I personally would entertain. And I don't think, in terms of non-destruct rescue, there are a very small handful of very good ones, and then a lot of crap ones, essentially, that do dogs in kennels. So I hope that sort of clears things up. So
absolutely.
There is kind of euthanasia within that world, but it's sort of for instance, the cockapoo. So one of my clients recently wanted to euthanize their cockapoo that they bought off the internet, and he was attacking his own tail. He had a bite history. Long story short, I saw potential in this dog, and I saw that it was medical and he needed more intervention medically. So I managed to convince my mum to house him for me while we got his medical in order. Once he was under my care, I got his medical in order. I have an amazing vet behaviourist who's a good friend of mine, who also just helped to kind of tell the vets, okay, this is the analgesia plan now, and everything. And he has done a lot better. He's got into a wonderful rescue called Wonky Pets. So yeah, if anyone wants to donate, who are going to try their very best to get all the medical stuff done. Unfortunately, yesterday he was diagnosed with several other issues. So on top of his analgesia plan, he's on an epidural to see if that works for 2 weeks in terms of getting pain under control to a point where he would be emotionally stable enough to go through surgeries and things. He's only a year old.
He's only a year.
Yeah. So if after that, this 2-week period working with the specialist neurologist and stuff, if his quality of life does not look like it's going to be good, then he will be humanely euthanized. So, that it's when I say non-destruct, like I said, I think that's a really good example of like, there are boundaries. It's not like we're just keeping dogs unhappy sort of in a kennel environment. And there are numerous, a very small amount of rescues that do really good work like that, but I'd say like probably max a very under 10 in the country that
wow. And if you compare that with the amount of dogs who desperately need this level of intervention, it's the scale is
exactly
is unimaginable. Sorry,
it's unmanageable, and that's where we do get to a point where euthanasia with certain cases, if I can't find, if anyone goes on Instagram, they'll see about a story about a dog called Stevie, who was my first ever behavioral euthanasia case as a qualified behaviorist.
Was he cream? Was he like a tanny sort of light colour?
Yeah, he's blue male, sort of bull breed.
I think that's how I found you on Instagram.
I posted a lot about him. Unfortunately, he was denied a pain trial for 3 months, even though with all the gay videos and everything, he was agoraphobic and he had stranger-related aggression. But we built a really beautiful bond together. He was a really lovely dog. He lived in a house with a shared a space with a tortoise, a free roaming tortoise. Like, he was a really gorgeous dog. I found like really, really obscure sort of gait abnormalities. Unfortunately, the vet felt that he was too young and too strong to be suffering from pain that could be relating to his aggression. There was a lot of complications within the home, and he nipped. They had him on they hadn't had their fencing fixed, which obviously as a behaviorist I've been asking them to do for several months. I've been working with them. They hadn't had it done. They had him on like a line. He broke the line. A delivery man came to the door and he nipped. It was like a level 1, level 2 bite. Guy on the arm. He was left at home with the female caregiver, the wife, who actually had a brain tumor, is going through different surgeries and things, while the husband was out day. So it was a really awful situation. And they very quickly, because when they first came to me, this dog was booked in for euthanasia, but the vets referred them to me to be like, hold on a minute, he's 10 months old, like, let's see what we can do. But unfortunately, the same vet wouldn't really work that collaboratively. At that point, I didn't have the connections that I have to do like medical, the cheaper medical reviews of vet behaviorists, which would of course build a time, but unfortunately wasn't I didn't know about that service. So sadly I couldn't get any reinforcements, also just because they had a lot on their plate. I couldn't get any reinforcements in terms of veterinary. And I followed what was kind of told, I was told to do in my clinical group, and they said, don't sort of offend the vet, don't send lots of cited resources to necessarily offend the vet.
I'm laughing because
but also stay within the same practice. So and to be honest with you, like with bull breeds at that time, and it's motivated me to work quite differently this particular case, but at that time I didn't really have any vets that would necessarily recognize pain in that sort of behavior, except for a vet behaviorist. So I didn't have the connections that I do now, and they did not, they very swiftly decided that he needed to be put to sleep. I didn't have time to get him into I had to try and find somewhere, a 1-year-old cane corso cross bull breed. There's hundreds of thousands waiting to get into rescue that haven't bitten anyone, so unfortunately was euthanized. But so that's
it's heavy.
There isn't a space that's
it's heavy. And I think the kind of coming back to the pain aspects, so of course we're going to be talking about pain today because I'm obsessed with pain. And when I first qualified as a canine massage therapist, that's how it started, and I learned how to identify a lame dog. I was like, holy shit, they're everywhere. Oh my god, like, this is, how on earth have I walked through life saying that I love dogs, not knowing that the majority are in some form of discomfort. it was like this, you like peek behind that little curtain, don't you? And then that's it. That's it. That's, you can take the fun out of anything to do with dogs like instantaneously.
Yeah.
And the pain aspect, like we did cover it in my qualification. I was like, oh, I think actually I need to know a bit more about this. So this is the first kind of additional qualification I did was with canine arthritis management. They're level 1. They are such a phenomenal resource of free open access stuff about pain. And I did their level 1 and I was like, oh my God, right, okay, so what do I do next? And then it just started this catalyst, this journey where now I will only see painful dogs. And that then formed into seeing painful dogs who have quotation marks, behavioral issues. I just call it feelings. It's an expression, it's communication. So it's those dogs that come to see me. And it tends to be, it's a bit of a mixture. So I have quite a young cohort of dogs that are recently diagnosed, and they're starting the beginning of their pen management journey. But then I've got another kind of group of dogs where it's last chance saloon, and they go, we don't know what to do. We think it might be pain. We think it might be pain, and that involves doing a gait analysis, bringing the dog into clinic, and sometimes I won't even touch that dog because there's so much I can tell you without touching that dog, without putting them into. So a big part of my work is consent-based treatment. Pain is emotive. Pain makes you feel so unsafe. And pain is unpredictable, therefore pain makes you unpredictable. As someone who suffers with chronic pain myself, I can absolutely tell you how much it impacts my emotional and mental well-being. And that's on a good day. It's always there. Chronic pain's always there. Once you open up those channels with chronic pain, you can't shut them. They just kind of keep expanding, right?
Yeah.
So from a pain perspective, so you've been doing this for 16 years now that you've been in this industry.
In terms of getting into the pain stuff, that's been the last sort of 4 or 5 years, I'd say.
Yeah.
But I just wanted, the first thought that comes to my mind though is like just what you were saying about the suddenly peeking behind the curtain and recognizing, oh, like all these dogs, it ruins your life. I can't I live in London. Honestly, I just walk around. We have a kind of running joke now because my partner will just go point at dog. I'll look at a dog and my partner will go, oh, abnormal gait, gut inflammation.
My husband does the same. Yeah. We could take the fun out of anything to do with dogs, but I always have to kind of like remind myself, even though it's like, it's a bit of a, part of it is a shit job. It's a shit title to take up, like that you're going, oh God, like I just can't see any dogs that aren't painful. But then like the flip side of that is if we can open that conversation and open that dialogue,
for sure.
We can change the trajectory of a dog's life. And save quotation marks, save lives, without it sounding like fucking cliche. But if pain isn't managed effectively, it is a matter of life or death.
It's also just, it's so obvious, isn't it? Of course that dog is grumpy or aggressive or fidgety or restless because they're painful. I mean, of course, like the first, like when I first heard that, I was like, that is so obvious. Because actually, if we look at things, and sometimes you get the odd clients, usually that haven't had other dogs before, like don't have that learning history, and they're looking at dogs very plainly, without that kind of conflicted how this dog should be. And every now and then, I'm sure you've had it, you get that client that goes, I just think that actually, maybe the dog's uncomfortable because they're doing X, Y, and Z. And you're like, yes, because you have no previous kind of expectations of your dog. You're just looking at the dog as they are. And I think when you look at these cases plainly, and sometimes it's not, sometimes I have to say, like, I do hear behaviors going pain, 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 pain. And there might be a specific dog where it's like, pain is an issue here, but it's not the whole picture. And I think it's really important to have that balance as a behaviorist, because I have seen that happen. And also focusing on one type of pain, there's certain cases where people have focused really, really heavily on the musculoskeletal pain, not thinking about the subclinical GI issues that
Because GI pain is painful. Any pain is painful.
Yeah,
Somatic, visceral pain. Like the thing that I always say to people, like, is one really common kind of like issue, ear infections with dogs. I was like, do you remember having an ear infection when you were a kid? You were agony, wasn't it?
Yeah.
When you take your dog to the vets to have antibiotics or something for their ear, ask for pain relief as well. I always remind people that when you go to the vet, you are paying for private healthcare. You are allowed to ask questions, obviously respectfully, but they've got 10 minutes. And if it's they go, oh, yeah, actually, I will give them some pain relief. Anything, what's the rule? Anything ending with itis or something like that is inflammatory. And if you have inflammation, the chances are you are going to have some discomfort there. Even a dog that's eating something that they shouldn't have and they're shitting through eye of a needle, stomach cramps are painful, gas can be painful, burping can be painful, indigestion, acid reflux. Like it's the landscape of a dog's pain experience is going to change depending on so many factors. So from, you know, how they came into this world, whether or not they were born via a natural birth or a C-section, depends on how quickly your central nervous system starts reacting, which is then going to change the tapestry for your dog's lifelong experience with this world and pain experience in this world. So thinking about a genetic perspective, so I'm going to bring it back to bullies because you specialize in bullies. So I'm really interested to get your thoughts on just bully breeds and pain. Discuss. I'm going to chuck that at you. Discuss.
So I'm actually doing a talk on this for the APBC on the 1st of June, which is very exciting.
Amazing. Congratulations.
Still finishing off my slides, trying to scrape in. Of course. Okay, so bull breeds and pain. Here's the thing, and this has been scientifically documented. There's a great study I'll have to pull up.
Oh, yes, please email it and I'll make sure it's in the link on the podcast.
Have a look at pain perceptions across breeds. So on a whole, you know, our perception of bull breeds is they're going to be less painful or they have a higher pain threshold than other breeds because they're bred for, you know, a lot of them are originally bred for bull baiting and dog fighting. Here's the thing, the data actually says that when you compare them to different breeds, they don't have a higher pain threshold actually, but that their behavior is different in comparison to some other breeds when it comes to pain, and that potentially they show more hyperactivity. So that is what the data says. Now, this is what I find all the time, and it brings us back to sort of Stevie's story where I was saying, you know, even if I had pushed to take him to another GP, it probably would have been the same story at this point. Oh, GP vet, sorry. It probably would have been the same story at this point. Likely, maybe not, but it's likely it would have. So what if we look back at the history of the bull and terrier type dogs? So that is kind of, you know, your bull baiting days, those early days, butcher dog days. These dogs were bred to essentially, and what gameness is, as a kind of quote when you look back at the archives and stuff, is a dog who will fight through death. Wow. So what does that mean? What does that mean if we break that down and look at it as a scientific community? Does it mean they need bite work? I don't think so. What I think it means, is that actually they're bred to get stressed and stay there. And in the face of adversity, they are bred to get more hyper aroused the more painful they are. Wow. So in the old archives, horrible archives and stuff, if you want to have a look, you can. I don't encourage it, but yeah, if you're curious, you will read things of, you know, a dog's leg hanging off and him still going in even harder to go and, you know, kill another dog. And what I'd like to just caveat there as well is you've got to remember like how diluted these dogs are now, particularly in the UK. You know, there's very few strains of like purebred pit bulls, and things, and actually, you know, a lot of the genetic basis for, you know, for a bull breed, a bull and terrier type is such a mix of different breeds, and there are some generalizations in behavior. Like a big problem I see with stressed and painful bull breeds is excessive grabbing behaviors, which is then further exasperated by, you know, both positive and punishment based training, thinking, okay, these dogs need to bite, they need to play tug, and it's like, they don't need any of that. Actually, they need a lot of back molar chewing, they're mouth orientated, they need to dissect things, you know. A little bit of tug can be great as a reinforcer, but if you've got a painful dysregulated bull breed, the last thing you want to be doing is kind of sticking them on something where you're keeping them in that high arousal state. You want to meet them where they're at and then get them dissecting, moving down onto slower sensory activities. It's really interesting. I've got some really interesting footage of some cases. There was a little staffy. Unfortunately, at the last hurdle with the specialist, they saw a chiropractor who convinced them that this dog wasn't painful after lots of long, hard work, which is always fun. Yeah.
Oh,
we know about that, don't we? That's always
we know that, yeah.
But this little staffy, 1-year-old, had been in 10 weeks of puppy classes, just constantly ripped up equipment, couldn't engage at all in training. Puppy school eventually kind of referred them to me just before, it was about a year old, I think, at this point, that they'd done bits with this puppy school, gone AWOL, come back. And this sort of like frantic grabbing issues. And I've got a really, I was about to say something really inappropriate, a video of this one dog, and he is literally running from one end of the room. Now, this dog hasn't had any aversive training, I just want to add in. He's with quite a nice family, very placid family, quiet household, big garden, like, so this is not like, oh, I know something's, you know, they might have had the odd, you know, go to bed or whatever and been told,
but nothing
like an aversive household. He's had positive reinforcement since puppy. Now, this dog runs from one end of the room to the other in this video and latches onto this girl's leg. Like,
oh,
yeah. And she's going, you know, get off or whatever. Now, what is also really interesting about this dog is from a young age, he had basically no appetite. Really struggled to eat maybe once a day, struggled with loose stools a lot. They tried lots of different foods. Vet was dismissing him because every time he came in, you know, he was hyperactive and bouncing off the walls and very friendly and blah, blah, blah. Long story short, and it was a long story because it was a long haul to get to that point. The vet finally agrees to do x-rays, because I picked up that actually when I went round there and we got him tucked into some free work and slow sniffing, he was completely lame on one of his legs when he wasn't bouncing up and down and running. That actually, once we lowered those arousal levels, he was moving really uncomfortably. And the other thing that was really interesting is he'd go really hyper for about 3 minutes and then lie down flat like a frog. Get up and then lie down. So anyway, now vets were like, he's not painful, this, that, and the other, blah, blah, blah. Get him to finally have an x-ray. First vet says, oh, there's nothing wrong with the x-ray. They then go to an orthopedic specialist vet, the scans. This dog had such severe hip dysplasia that he needed a hip transplant. What's the word?
Total hip replacement.
Hip replacement. Sorry, my brain switched off. At a year old. But this dog literally is running and
how severe does that hip have to be to warrant a total hip replacement in a dog that's a year old? And as well with the bull breed, or with the staffy, they are so muscular. You are not going to notice or see that atrophy because potentially it's not there yet because they're so young. And it's interesting with the fizziness. I had oh my days, it was a staffy. And he was a year old, and he was really struggling with separation anxiety. So he was working with force-free trainer, and she's like, I think there's something off about him. So he came to me for a gait analysis, and I looked, and I went, as a vet looked at this dog walking up and down, like, because to me it's blindingly fucking obvious that there's something wrong here. And she went, yeah, he had a gait analysis when he was 9 months old, and the vet said he's still learning how to walk. And I went,
interesting.
Right, so that's a crock of shit. That's I just say it how it is because
Yeah.
I get so angry, not at the pet parent, and
No.
not even at the vet. It's just like I'm angry at the system. I'm
Yeah,
angry
no,
at the
me too.
system, you
Me
know?
too. That's yeah.
I'm angry at the system, and I'm like, okay, so this dog we have a gait abnormality here. I was like,
Yeah.
let's strip everything back, the behavior, the whatever. Da, 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 da. I was like, when this dog is moving, because obviously you have to give them time in a new area to settle into that gentle movement. Because when they get out the car, you're not going to see anything because they're going absolutely crazy. I'm trying to think how many I've got. Few staffy crosses, and then I've got staffies that come see me in clinic, and these dogs are fizzy. That's how I describe it. They are fizzy.
Yeah.
If you have a painful dog that's fizzy and you touch them, it's like a can of pop and they go and they can't cope. So sometimes even hands like hand on touch is so intense for them, but it's mixed in with that hyper arousal. So it's like the way that I work with that in clinic is that we use like lick mats and stuff. I tend to have to use lick mats because we have to capitalize on that hour that they're with me. But
well, a lot of them as well. I know with my dog, which I'll go into her because she really set me on we all have that dog, don't we?
Yeah.
Path for pain. But yeah, I find lick mats with really hyper aroused bull breeds actually much easier to access as they're straight away kind of sensory chilling them out rather than licking than sniffing or chewing. So yeah, I can definitely see why you're using.
Yeah, because sometimes like using food in clinic, like pet parents will go, do I? And I'm like, listen, it's your hour, it's up to you. It's better if we don't. However, you're going to spend a lot of time in here of me not being able to do much because it's too and it's dog to dog dependent. So with say I'm thinking of Ralphie. He is a staffy cross. Is he American bulldog? He's beautiful. He's big, chunky, gorgeous boy. Oh my god, he's delicious. And I've worked with him I've worked with him for about 5 years now, and he's bilateral luxating patella, grade 1 and grade 2. So he comes like once every 4 or 5 weeks just for a nice little top up and chat about pain, blah blah blah. And he has to have a lick him out. He is so excited when he sees me. He's like, I can't believe I'm here again. I'm like, you are here again, Ralph. And he does his wall of death when he comes in, and I'm like, excellent work, Ralph. And he's like, I can't breathe. I just love this so much. I'm like, love it. Thanks, Ralphie. Right, let's get. And I'll just park that lick him out in front of me. He goes, oh, thank God you've given me something to do. Now you may continue, Auntie Az. And then when it runs out, he does a little lap. He goes and gets a drink, and then he'll come back again. It's like his ears switch off. It's just so exciting for him. But he lives in a busy house as well. There's two kids under 2. But he's gorgeous. He's absolutely gorgeous. And that's just how we work. Whereas I've got another dog that, say for example, she's is she a cockapoo or a labradoodle? I'm just thinking of Luna. So Luna, she has treats. And then we wait and we do a drip feed. Trying to do that with Ralphie would just be near on impossible. It just wouldn't. He's just not built that way. No. He just wouldn't cope with that. But I think that must link into the hyperarousal levels.
Yeah. So what I see most commonly with bull breeds is pain and hyperarousal. So that combination. And I do now. So since Stevie, what I have now is I have my naughty and nice list of vets. So I generally will send dogs to specific vets that I work with, that I build relationships with, that have an interest in behaviour, and also are just really, really thorough. Generally speaking, I mean, you know, vets have their GP vets have their area of interest, and the specialist vets, and that's often, I explain to my clients that, you know, not every vet is going to pick up on, you know, necessarily all the things behaviorally that could represent pain, just because actually, you know, their interest might be in surgery, or it might be in dental health, or whatever. And I always explain that to my clients. It's not about them, you know, not kind of doing a poor job or this, that and the other. It just depends on where their interest is. So the vets that I now mainly use have an interest in sort of musculoskeletal health, in gut health, and in behavior. So it helps a lot, you know, because Sarah Heath does some brilliant, very accessible
Sarah Heath,
for vets.
Amazing.
She's amazing. She really turned me on to everything. But yeah, I mean, the way it started was I had a Staffy cross called Lulu that I had for 9 years. She was found tied up on the North Circular motorway with her head bashed in, and I got her in, I think it was 2011. And she was in the pound. And I had her for 9 years, and she was fantastic. And then January 2020, she died very suddenly of hemangiosarcoma.
I'm so sorry to hear that.
Yeah, although I had blood tests and stuff, actually nothing was picked up, and took her into the vet one day because she'd gone from playing, you know, and actually that's a really good example, because that morning, obviously she was a Staffy cross. That morning I've got a video of her jumping on playing with a puppy, jumping around, running around, and within an hour she just wouldn't walk home. And then when I finally got home, she wouldn't eat. I said, and she never, ever didn't eat. So I took her to the vet. They thought she'd been poisoned. I said, you know what, she put on a little bit of weight. Let's just do an ultrasound. Unfortunately, she just had cancer all over her abdomen. So that was really, really difficult. And then after that, I really struggled to get into like just a normal, like I couldn't eat and things. It was, with losing a dog, it's such a different experience to losing, I would say, in my experience, of losing like a close family member, because they're also part of your daily routine as well.
100%.
All the other things, and they really see sides of you that no one ever sees and things. So
the bond is like no other.
Yeah, so I really struggled with that. And then I because of working in rescue and stuff, I get I'm part of like sort of a network, so I get every dog that comes into, or most of the dogs that come into all the sort of pounds in the country, coming up for, they put pleas up basically to find rescue spaces. And there was one over there that came up, and my plan was to sort of foster, and then when I was ready to adopt a dog, I would get a 4-year-old Staffy that I could chuck under my arm and, you know, get on the train with or whatever. Anyway, but everyone was encouraging me to get a foster dog to focus on something I wasn't able to cope with. Anyway, long story short, she came into one of the pounds. My friend dog assessed her, and she was a bit stiff and I'd seen her the month before, actually. Lulu had died, and I sort of was like, oh, she's nice, you know, she's quite up my street. So I quite liked the American bullies. And I was like, but Lulu wouldn't have it. And then a few weeks after Lulu died, and it was kind of apparent that, you know, I would need maybe to think about taking a foster, or rather I needed to do something. I followed up where she had gone, and she was in a sanctuary kennels, and I spoke to the rescue at the time, and they were like, I was like, oh, so what's she like? And they were like, oh, you know, just a normal little Staffy puppy, really. I get there, there's a sign on her kennel that goes, this dog guards, please do not enter. I was like,
just a normal Staffy puppy. God's sake.
Anyway, and she was sort of like, you know, up at the fence like this with her on her back legs, sort of looking at me. I was like, cool. So we went out into the paddock together. They were out into the paddock where I was, and she completely ignored me. Literally she was skin and bones. She was grabbing mud and throwing it up in the air repeatedly. She did that for half an hour, which was cool.
It was on her own journey.
I was invisible. And then I think they came to give her food, and I was like, oh, I'll give it. I put the food down, and she ate it. And then after that, she didn't look at me, but she just put her butt on me and just went like this. And I was like,
you are the chosen one.
yeah. So anyway, I left, and I called my partner at the time and my mum, and I said, she's batshit. And obviously I was very depleted at this point, and my mum just said, if you don't take this dog, no one's going to take her. And I went,
Thanks, Mum. Stop enabling me.
A week later, I went to get her. And what I noticed is actually they were very understaffed at this point. With this, is a very good rescue, but at this point they weren't getting much support. They were about to be evicted from their kennels. It was all a bit, and what they hadn't picked up on, unfortunately, is that she chewed off half her tail. Like she'd chewed a large proportion of her tail. But she's so hyper aroused all the time in the kennel. She would throw her blankets around. She would rip them up. So I can see where it was sort of missed.
Yeah.
And also it looked like she was coming into season, but actually it looked like we found out, within about a week. I took her to the vet a couple of times, and they were like, it could be an infection. So she went back to the rescue for a couple of days to see their vet. She had her tail amputated, and she was neutered. But the week that I had her, then she was very just shut down. She just would follow me around like this, staring at me and frowning, and I was like, are you going to kill me or love me? I don't really know. Didn't really engage with me. Like, slept a lot, took for a little plod a couple of times at Country Park, but then when I got her back after her operation, she jumped up at me and she was suddenly really hyper, and then it all came out. So then we got this chronically hyper aroused nutcase who would just lock onto arms, lock onto stomachs, guarding the house, guarding everywhere. Barricaded my flatmate one day, unfortunately, when I wasn't home, in from one end of the room to the one end of the flat to the other, rounded her up and into her bedroom, and pushed her into a chair, and then sat with her head growling on her lap, which was, she was quite upset about.
How do you even navigate your way out of a situation like that?
Yeah. So she was a lot of work. The grabbing was the worst part. The guarding actually was quite easily mitigated with using toys and stuff, because she wasn't food motivated. Because anyway, fast forward, she started popping up about a year into with some little mast cell tumours, just really little warts. She was only about 18 months when I got her, approximately. So this started happening, and she basically I basically pushed the vets, because it was only like, she only had a couple of them. I was like, I want to scan, because my last dog had died of hemangiosarcoma that I knew nothing about at the time, and it was a shock. So I was like, do it on the insurance. Just I want a CT scan. But the other thing that I picked up with this hyper arousal is also she would get a bit wriggly if you touched her in the middle of her spine. So I was like, I'd watched a talk from Sarah Heath, my favorite talk, if you haven't watched it, people who are listening, Who Says I'm Not in Pain, Dr. Sarah Heath. Fantastic talk about the interactions between kind of the HPA axis and stress regulation, chronic stress, and pain. And that blew my mind, because my thesis for my undergraduate degree that I did, I focused a lot on HPA axis amongst different breeds, including pit bulls. So that was of major interest to me. And then also hearing about, following Sarah Fisher, watching her webinars, finding out about her dog Henry, and I think there was another dog called Cookie who had this frantic grabbing issue, who turned out to have all the spinal pain. I was like, CT scan. Now on this CT scan, and now here's the fun thing, she didn't really have any gastro symptoms. She would very, very minimal gastro symptoms. She would occasionally, and I mean like 3 months apart sort of thing, vomit. And nowadays when I hear this, I'm like, okay, that's something. And she wouldn't eat much, and occasionally she would have a mucousy pain, occasionally. Okay, and she was 100 million miles an hour. Stuck her on a CT scanner, got her a blood test, got her a test for everything. She had pancreatitis, she had colitis, she had multiple slip discs all through her back. Yeah.
No.
She had liver disease and kidney disease. Now, this dog, when I say this dog would run for 3 hours straight and play with other dogs and get in the pond and pull these logs out, and just wouldn't switch off in play, would jump up and grab things, wanted to hang off trees, all of this. Like, no one in their right mind. I was told I was a hypochondriac every time I took it to the vet, because I was like, something is wrong here. Anyway, so she's my all-time best case study, because
Did you poster child?
She's my poster child, exactly, because actually she didn't need operant conditioning or training. We did a little bit. She wasn't regulated enough to do any training. She was completely untrainable for the first sort of 2 years. What we did was we worked with toys, with people coming inside the house. They came in, they gave her a toy. We did obviously a little bit of drop, and we did some recall with toys again. I'd have to have different toys. This dog was go, go, go. The epitome of gameness. Like what you would think a game dog is, she would do. But what the interesting thing was, she wasn't confrontational with other dogs in terms of her being aggressive. She would just do really full on play, and no was not an answer. So that was also an interesting behavior, which you can imagine dogs didn't like too much, which is actually the reason I ended up keeping her and not rehoming her even when she made the progress she did, because I was like, this could go very wrong very quickly. But yeah, so the interesting thing with her was, actually, once we sorted out all her organ issues, those grabbing issues diminished about 60-70%.
Wow.
And then were isolated to only when visitors came over. So, and then the next sort of thing was, the vets didn't offer me any pain meds for her spine. I eventually did some research and asked, let's try her on gabapentin, which helped. And probably she was given like 200 milligrams twice a day or something at the time. For a 35-kilo dog, which is an interesting dosing. Classic. So and then I started obviously researching more and more about pain, like you, just really got into a rabbit hole, did all the CPD, did really, really, really started getting into a rabbit hole of it. At the same time, working as a behaviorist, seeing pain everywhere, learning as I go, working with vet behaviorists. I utilize vet behaviorists a lot, guys. I would really, really encourage you to utilize them, because honestly, they are fantastic. Highly recommend alongside cases. So helpful.
Yeah.
But yeah, I learned so much. And doing the chronic pain symposium and working. With the dogs. So I asked the vet. I was like, look, I want. Oh, this was the other thing, because previously she had Rumicam, and she turned into a psychopath, and her behavior had regressed 4 years, and was suddenly grabbing and stuff again. So I was like, okay, not good for her tummy. And I started to learn that was the gastro-related issues. And we tried different NSAIDs, same thing. So, and NSAIDs and pancreatitis don't go hand in hand anyway. So, but even once it was resolved, that was something. So that's something I really take into cases, is looking at, the cascade, and whether the NSAIDs are necessarily, obviously I'm not advising the vet, that's not within my legal remit. But, I will educate my clients in, if the dog has a history of gastric issues, you may not see a difference in their behavior once on NSAIDs, which is the first drug that they will select for musculoskeletal pain in a pain shot. But anyway, I said that I wanted paracetamol as well, as in paracetamol, that was much better. Still, the dosing was all too low. So ended up going to Dr. Amber Batson, having a medical review. Because I thought, if I'm going to do this, I'm going to do it right. The best, yeah. So went to Dr. Amber Batson, who upped some things. She sent me to the Renew Centre, where Piglet had. We love the Renew Centre.
Love it. Shout out to the Renew Centre. I send a lot of people there.
Yeah. So they did the pain trace. Rachel was the vet there. Rachel is absolutely
phenomenal, isn't she? She's
And they added in a drug that I'd been interested in for her, which was amantadine. And Amber had pointed me more towards memantine instead of amantadine, because memantine is apparently slightly easier on the gut, and it's a game changer, that drug. That has been amazing, and it needs to be utilized more. But it sounds a very long version, but that's a very short version of Piglet's story. And then the amazing thing was, after Amber Batson's tweaking with her pain meds, we could start doing proper training. like she would learn. It wouldn't, it took her 3 months sort of thing to learn cues. And we started doing middle, we started doing scent cues, like all these amazing things started to happen. We can play tug now without her trying to latch onto someone's face.
Yay, positives.
So yeah, it's been a real journey, but it's been an amazing one, and that really painted my journey, as well as my degree and stuff, my background rehabbing, but that's how I got to where I am now, and all the information that I'm so grateful to have about pain.
And how lucky is Piglet to be able to utilize?
Look at my messy house.
Where's the baby?
See her there? Can you see her? Shall I?
Is she underneath a blanket on the sofa?
Yeah. So she.
Oh.
Let me tell you a little secret about bull breeds. They get really cold.
They do get cold.
And when they get cold, they get grabby. And when they get hungry, they get grabby. So those are a couple of things. Not all of them. Some of them have coarse coats if they're depending on their crossings and stuff. But a lot of them, especially sort of more pit bull types, some of the
they're like a blanket. They're like a little.
They need a blanket. Yeah. She gets really hyperaroused without her fleece in winter, and it doesn't come out as anything but hyperarousal. So hungry, need to poo, hyperarousal.
So. Little Piglet. Well, I'm so pleased that you've managed to. It's like opening a series of doors, isn't it?
Yeah.
Like you with all the work and your experience that you've got, then you've opened another door and gone spoke to this specialist, and then it was a tweak here, and then it was Rachel at Renew, and then it was the pain trace, and then it creates that picture of what Piglet's pain management looks like, because it's going to be different for every single dog. It's going to be different. It's not a case of here's your blueprint and that's how we deal with hyperarousal from pain. That's not the case. And especially, I mean, we don't have time to go into it today, but hypermobility and hyperarousal. Oh my God. And I could talk about that a lot, especially with cockapoos or anything doodly. They are so hypermobile. And I took my dog Rodney to Rachel to get a diagnosis of hypermobility because he's a crazy
mobile as well. Diagnosis.
So I traveled 4 hours to take Rodney to Rachel. I remember my GP vet saying to me, he went, because Rodney was doing the wall of death in the vets, and I was like, I can't stop him, like, just don't touch him, I'm just going to talk to you at this point. Like, there's no point. And he was running around. I was like, I'm really concerned about his chronic pain levels, and I don't think I'm managing his pain effectively with his current pain relief. And Rodney's like they have like a sofa and stuff, and this got like that, and he goes, I don't think he's in agony. And I was like, like my head like tweaked, and my husband went, I think what Yasmin's trying to say, because I was like,
I mean, that's always the way, isn't it?
Isn't it just? But Jess, I'm going to have to stop us there because we have been gassing for nearly an hour. I knew this had happened. No, don't you worry. I'm like this, like listening to you with like my eyes like wide open, like this is so interesting.
So sorry, when you said half an hour, 40 minutes, I was like, yes.
Yeah, so good. Like, maybe cool story. Cool story. No, I'm terrible. I didn't put a timer on either, but it's just so interesting listening to different professionals talk about pain and how, that, like, especially with the hyperarousal stuff as well, like using it in clinic and everything is going to be so valuable. So if people would like to work with you, so it's not just bull breeds you work with any dogs. If people would like to work with you, how do they find you? What are your socials?
Yeah, so my website is probably the first place. So that's littlelargedogs.com. My Instagram is another good place, Little Large Dogs LDN. And you have all the details of how to get hold of me on those two platforms. And I do also work with the London Vet Behaviourist. So those are a few different places you can find me.
I hope you found that episode as insightful as what I did. From learning more about hyperarousal from a behavioural perspective is something that I can certainly take away and apply to in a clinical setting. If you have enjoyed this episode, please make sure to like, share, subscribe, comment. Make sure you check out Jess on her socials. That's Little Large Dogs London. And from myself and the entire YPT community, best of luck to Jess in her new role. For now, lots of love. Take care. Bye.